Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
They're polite. I mean, they just take the time for you.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
I like the Angels for what they've done for me.
Angels Care Home Health. We serve patients.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching. Thanks as always to the producer of our series, the editor and behind the camera man, Jeff Durall. We're at the Hays Veterinary Clinic today for our Community Connection at 1016 East 8th in Hays with the owner, Dr. Steve Mosier. The Hays Veterinary Clinic, a fixture here for about 71 years now, as we figured. Jeff did the math for us. As we look to a visit with Dr. Mosier about pet care in general and about the facility itself. Well, let's begin with, first of all, congratulations, Steve.
Thank you.
You had recently received an award from the Kansas Veterinary Medical Association as a Distinguished Service Award.
Yes.
And may I say, well deserved, sir.
Thank you very much. I appreciate that.
Absolutely well deserved. Somebody said, and I won't name who, but she has this little puppy that comes in once in a while for heartworm medication and dog treats, etc., who said, Dr. Mosier thinks that every person that comes in with their pet is the most important person and pet he'll see that day, and that comes across.
Aren't those kind words? Huh? They really are.
And that's an almost exact quote too, Dr. Mosier. Give us a history of the clinic, would you?
Clinic was started, I think, around 1945. I think it was Cordish. Dr. Cordish was here. Then I think Dr. Dubin came along. And then after that, Paul McRae and Dr. Plater came in as partners. And they came in, again, 52 maybe in that area, 52. And they were here for, quite a few years. And then Dr. Plater left in the late 70s. And then Dr. McRae, I came and interviewed and was fortunate enough to get the job in about 1970. And then a little later, Dr. McRae went into embryo transfer and got out of here, and Dr. John Locke came in, and we were partners for several years. And then we've gone through a succession of veterinarians. I'm really hard to work with, apparently, because I'm the only one still standing, and so you got to wonder, don't you?
There's something to this longevity, Dr. Mosier, believe me, absolutely. What kind of animals, now initially, I know you worked with larger animals, you kind of downsized then.
Right,
huh?
exactly right. Up till about 3 years ago, we were a mixed animal practice. We did horses, cows, small animal, and about anything that came in. And then about 3 years ago, Dr. Wiedenhoff, who was with me at that time, wanted to buy in, and we were thinking about that, and then decided the best thing would be he would buy out the large animal portion, and has since moved to the west side of town. And so then we stayed here doing exclusively small animal medicine.
Over the years, Steve, has there been a most unusual animal treated?
Yeah, and I think there's been several. The one that comes to mind probably is wallaby. Had a wallaby come in, and it was an interesting story how that wallaby got here. But it was in Wichita, really, and it came up, and it was on a holiday, and they said, well, they knew somebody that knew us, and they knew we worked on anything. And so they brought that wallaby up, and it was really a nice little animal. I mean, they handled him and everything. She came in, it was a nurse and her husband, and she had a kangaroo that she was feeding as she came in, and he was holding the wallaby. Well, the wallaby wasn't eating and everything, and we looked at it and hooked it up on fluids and sent it, and they took it down and were kind enough 2 or 3 days later to say, that wallaby's doing okay. And I told them when they called, I said, I don't know anything about wallaby, but from the time they took from them to drive to Wichita to here, I was able to get on the internet and maybe tune up a little bit on wallabies.
I was going to ask you if you went back to your medical records and researched wallabies for treatment. Tell me about your staff and the vets offering service here now.
Got the best staff in the world. You know, and that's why I've kept in this business as long as I have. I've had a support staff that is just unheard of, both in the veterinary line and in the staff, the receptionists and everything that work up front. Just tremendous people.
Got some new people coming in here recently,
We
too.
did have. We got with the veterinarians on staff are Dr. Holloman Pope. She's been here about 6 years. Dr. Meyer has been here about 2 years, and Dr. Alex Greaves, better known as Moran Greaves, that joined us in June. So yeah, there's 4 veterinarians here, and again, we're all supported by the staff that's up front. You know, they run the show. You know how that works.
Oh, yeah.
Okay, yeah, you bet.
That's the reason you and I just sit here, and the show is run behind the camera
right,
there.
that's right.
We
Jeff's
all
over there
know
doing
that
that.
and realize that, Steve, for sure. Class of 1966 then, so how did you choose this veterinary medicine career?
I have, you know, in high school, I always thought I want to be a dentist, you know. And then I had 4 brothers that were veterinarians, older than I. And so I thought, well, if they thought it was okay, it must be an okay profession. So that's how I got into it. Yeah, was raised on a farm, you know, and so went into veterinary medicine.
The opportunities now to kind of step back a little bit, maybe, with the new staff, with your complete staff here?
Yeah, I got a chance to kind of watch, and it's amazing. You know, everybody says, how about continuing education? I get my continuing education by new staff, people that come in. They come in, and I learn so much from these new graduates and everything, and the new things. And so, yeah, an opportunity to back up a little bit. But I pretty much still work full time.
Well, speaking of that, what kind of transition has there been over the veterinary medical profession over the years? The same as for human evolution, if you will, of treatments, facilities, availabilities of different drugs and different options, Steve?
Very much so. It's been a real, you know, and it's one of the things, I've been in the business long enough and I've seen a lot of these things, and just like you say, you step back and you look at it, but there's got into more specialization. There's a lot more specialists, you know, there's dermatologists, there's cardiologists and everything, and we have a real bank of people to refer to if we don't think we can handle that patient here. The other thing is a lot more high-tech stuff. There's a lot more, you know, blood work and x-rays and everything. Even though we did that early on, it's getting a lot more sophisticated.
Have you expanded the facility itself, the physical facility, through the years, Steve?
Well, yeah, well, basically within the last year, we've doubled the square footage in the front area. Yeah.
Tell me about the other part of your life out in Estes Park, Colorado, would you?
Yeah.
For you and Linda.
I am fortunate to be a father of 4 girls, 3 of which live in Estes Park. And they got there by the fact that in the summertime, when they were in high school, we would send them out to Estes Park. Her folks lived there and had an old rustic cabin, and it was that. And we'd send them out there, and they would waitress through the summer. And then, so that's how the attachment to Estes Park came about, along with the attachment of her folks having a cabin out there many years. Yeah.
And any in veterinary medicine?
No. Nope.
Stayed
I do
away
have,
from it.
there are 3 of them out there, and one, Kayleen, who is still here, has been with me for 16 or 17 years.
I thought Kayleen was still
yeah,
here.
She kind of runs the show. Again, she runs the show, and if I do what she tells me, I get along pretty good. But
Tells Dad how to hop,
that's
right?
exactly right. That's exactly right.
What is it, Steve, about pets, the companions that we choose, that we relate so much to as human beings? What is that bond? Have you figured it out?
Well, you know, they finally came up with a name, the human-animal bond, you know, which is a good term. But we relate to animals so well, you know, and they give us back so much, you know. You've got Katie, right? You know, you kind of like that dog, don't you?
Oh, man. I had no idea, Steve. No idea at all.
It is. The attachment you have, and you have to a dog. And through the years, I've had pets that have been and favorites, you know. Right now, I have I got a bulldog, a French bulldog named Pogo, and he's just uglier than sin. but I really like him, and he thinks I'm okay.
And he doesn't judge you, you don't judge
Exactly
him,
right?
right?
Exactly right. Yeah.
That is amazing, isn't it? And they bring so much to us. You know, you've seen over the years how pets have been incorporated into assisted living facilities with traumatic injuries, with returning vets, those kind of things, how they really help us.
Best therapy in the world. You know, I think you can do anything, but you walk a pet through, like you say, an assisted living, those people, they lighten up and they say, and they bring back memories of what they had in their childhood. But it is best therapy in the world. Yeah.
Not so bad either for the physical aspects of being able to take the animal out, you know, if dog owners particularly,
You bet.
for walks and
You
such.
bet. You bet. Again, I think I can see these dogs when they come in. I can see which ones have been on a routine walking type thing. They're just walk with a little more step. And you're right. They get the people up and about and going, and it's such an amazing thing.
Talk to us, if you would, Steve, about some fall and winter pet owner tips, would you?
Well, and maybe not so much fall, but I think the main thing anymore we're emphasizing is if you get a new pet, take care of that thing. They say the socialization period of a new dog, especially, is 6 to 16 weeks of age. And it's really important that you spend time with them during that period of time and you get the behavior that you want from those pets at that time. The other thing that probably one of the more disappointing things, we have not done a good job as a veterinary profession in encouraging people to keep up on their vaccination program. It is so important. It's really disappointing when they walk in with that dog that's 14, 15 weeks old and it's come down with parvo. And that's a deadly disease, it's an enteric virus. The thing is, it could have been prevented. And you know, and you think, oh, God, if we'd have done that, we could have prevented that. Yeah.
And heartworm medication and so forth
medication.
like that.
You know, we're really fortunate in this area. We're a low incidence heartworm. But part of the reason we're low incidence, we have owners who are willing to give the heartworm preventative. You know, it's transmitted by the mosquito, you know, and the mosquito, he's hitting the airwaves with the Zika virus and everything. That mosquito's not a very friendly guy.
Yeah, absolutely. Also, in wintertime, something that occurs to me that our Humane Society has talked about is the winter trips for the animals out, snow and ice getting between the paws and such as that for those animals. The salts, the things that we put on the sidewalks to melt the ice.
Yeah, really important that you clean those up every time you go in. You know, some of them will adapt to a boot. Not very many of them like a boot very well. But you know, mentioning the Humane Society, they do a tremendous job. I mean, they really do. And you're right, when they come in from the cold, and you got to remember that everybody says, well, how cold can it be before I have to bring that animal in, you know? I think, you know, when it gets down, depends on the animal and the fur coat, you know, the hair coat. But, you know, if it gets down below 30 degrees, you got to be thinking, how uncomfortable are we?
Yeah.
There are some dogs like just go out and sit on the snow pile and just sit there, you know, and I think that's okay for them.
But again, with winter coming, you got to make sure there's shelter, there's water and food available and such, and a place for the dog to go if we do get some really bad weather.
Exactly right. You got to provide a shelter, a windbreak, and plenty of water, especially, and food. In the wintertime, they need more food. They need more calories to maintain their body heat.
Finally, in our moment or two, Steve, there are responsibilities for pet owners who accept the responsibility of a pet. Talk about a couple of those.
Exactly right. You know, everybody thinks, boy, I'd sure like to have this pet. But you got to step back and say, it's an investment. You know, I tell people it's an investment, not an expense. You can be looked at either way. But it costs to keep that dog up on vaccinations, on good food, and the care, you know, especially if something happens traumatic. You know, there's getting to be more and more pet insurance. We are not into that very much, but it's certainly something worth looking into. I think if you get a new pet, look at pet insurance and see what it's going to cost, see if you want to do it, you know, and go that way.
And the pet owners need to realize that, as you said, there has to be socialization, there has to be exercise. There are responsibilities to pick up after your pet if you're out and such.
You bet. I think that's one of the kindest things you can do is carry that little plastic bag with you. And by golly, if he leaves a deposit, you probably ought to pick it up.
Congratulations again, Dr. Steve Mosier, on the Distinguished Service Award from the Kansas Veterinary Medical Association. at the Hays Veterinary Clinic, 1016 East 8th in Hays, with our Community Connection, Dr. Steve Mosier.
Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
And the Angel Care nurse comes to see me once a week.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
Angel Care has helped to stay home.
Angels Care Home Health. We serve patients.